Good evening, ladies and gentlemen. Dr. James Lyons-Weiler coming to you live from the WWDNYK studios here in Pittsburgh, Pennsylvania. I'm very, very, very keen to introduce you again, if you haven't had the pleasure of enjoying the discourse, conversation, and collective wisdom of myself and Dr. Michael Gaeta. Michael, welcome to the studio, man.
Thanks, Jack. So happy to be here. We've done so much together virtually, and I'm pretty amped to actually be in the studio live with you on my cross-country trips. This is pretty awesome.
Yeah, this is cool. So you literally did a drop-in on us, which I think is fantastic. So where are you coming from? What are you up to?
Just spent a couple weeks on Cape Cod, and now I'm driving back home to Colorado.
You had vacation with the kids?
I did. It was fabulous. And so happy this worked out. And sporting a Cape Cod tan.
Awesome, man. Awesome. I want to be sure that I'm trying to set up a two-way here.
Yeah, sure.
Box one. And tell us about Michael Gaeta. Who are you? Why are you in my home? Why are you here?
Well, maybe because you're one of my favorite people and favorite research scientists. But no, I've been practicing now Chinese and functional medicine for 30 years. I've been teaching for 27 years, and I combine, these days I continue my clinical practice and teach other practitioners about functional medicine and educate the public about how to take care of themselves and their immune systems, and share in my weekly webinar perspectives on the pandemic.
All right, awesome. So, my friends and followers, etc., people of the world need to understand that this is a gentleman scholar that is a rare commodity these days in science. Family may differ, but I find Michael to be very unassuming, modest, and yet generous and kind. And so I have up as a surprise, you don't know this, I have up, hang on, I want to do this right here because you're my friend.
Okay.
That's not the right one. Let's see. Where did it go? There it is. You are Dr. Michael Gaeta, who I put up here as the Doctor of Kind and Good People.
Oh, awesome.
Right?
Thanks, man.
Well, it's true, because anybody
That's
that
awesome.
sticks with you in your practice, people attract, like people attract, right?
Yeah, it does. That's true.
So
it's vibrational resonance.
Yeah.
And we attract what we radiate.
Okay. So how can I attract some more funding for IPAC?
That's an
Do I
important
radiate
thing.
funding out to other organizations and get some donations into IPAC?
Yeah, right. I'm
I'm going to cut to the chase right here.
Yeah.
So what kind of health care do you actually practice?
These days, I primarily have a telehealth practice, working with people around the country doing functional medicine. And so I still treat patients in the office, and I live in Boulder, Colorado. But mostly work with people further afield with nutrition, diet, lifestyle, herbal medicine, supplementation, encompass their lab tests and their, just to help them change course.
Yeah.
And my whole motto is nature first, drugs last. And, help people, adopt a different lifestyle where they can get well and stay well and get to as close as they can to drug-free, or if they are drug-free, to stay that way.
So what kind of complaints do people usually come to you with? Like, what's the most common complaint that people come to you with?
Well, I've had a family practice for 30 years, and so I haven't niched out into just a single specialty.
Yeah.
So I love treating, geriatrics to pediatrics and all kinds of chronic things.
Yeah.
Probably things that folks get referred to me for, because it's a referral-based practice, are autoimmune conditions, digestive issues, and endocrine stuff. So things like diabetes and thyroid issues and things like that.
There's so much autoimmunity these days.
It's
right?
huge.
I mean, you've been a family practitioner for 30 years, so you've seen
just
massive
about everything.
proportion.
Oh yeah,
increase.
it's exploding. Well, it's an autoimmune epidemic, and that's why you are very thankfully on the guest faculty of my autoimmune mastery program, because most of my life is training practitioners these days to help them improve their patient care and their practice success. And I appreciate your like eloquent contribution to the autoimmune course, but it's definitely an exploding issue any way you slice it. And you and I are pretty up on like why that's happening.
Yeah.
But it's exploding, and people don't know. You look up, WebMD, it's idiopathic, but we know, there's very specific contributors to this thing.
One of the things that I've noticed, well, first of all, thank you. I really super enjoy teaching at Gaeta Institute from time to time. The lectures that I do.
Well, you're awesome.
I did one on lung cancer diagnosis, I think it was, biomarker
Yeah.
development.
Well, you focused on HPV vaccines. And
Oh, yeah,
HPV,
that too.
That was awesome. And then you did this great thing on autoimmunity.
Yeah.
And you get, all of the students are like, this guy's amazing, and
thank you.
We just learned so much from you.
Well, thank you.
As I'm a clinician, you're a scientist, so you bring the whole scientific perspective that I can understand, but you live it. I'm more of a clinician who teaches.
Yeah.
But you've got the whole science perspective.
I'm gonna have to go back and watch my own lectures and get
They're really
refresher
good.
course.
They're really good.
If you wouldn't believe the stuff that I'm into with people say I'm smart, but that's I don't come across like that I'm all full of myself. But
no, you're
last night I was on Twitter talking about how we need a new fundamental way of doing mathematics because we've really kind of screwed ourselves for thousands of years by assuming that zero exists.
Huh.
Right.
Wow. Okay.
Mathematicians are running for the hills, right? Because we really can do so much more. And last night in the middle of the night, I came up with something called vectored numbers or VNs. If we do mathematics with VNs instead of numbers, then you have a lot more information coming at you when you're doing mathematical formulas with all of the dimensions that a number comes to you with, and it's fresh in my mind.
Wow.
So I just wanted to throw it out there that we're going to be doing a podcast soon called Talk Nerdy to Me. I have two guys, they're called the Two Lewises, and we're going to get in under the hood on why zero does not exist and how we have completely tethered ourselves to one framework of symbolic representation of reality and math that propagates to us not being able to solve things in things like quantum physics. We simply can't. The math breaks apart.
Yeah,
it falls apart in the extremes because we don't carry all of the dimensions of each number. And I'll give you a quick example. Right. So, let's say that I have $5. Right, and I give you $5. How many dollars do I have?
Zero.
No. I'm -5.
Oh, right. Okay.
Zero's a conceptual placeholder from one frame of reference.
Yes.
And we lose that frame of reference, and we lose that dimension when we say zero.
Oh, okay.
And there's much more to this. There's much more that it involves. How did I get to zero?
Yes.
That matters. Who I gave or took the money from matters. There's a whole story. Every number now, to me, I can't look at numbers the same way again. I have so many questions.
Wow.
If you tell me the number 32, I'll say to you, I don't know where it came from. But I was describing this to Grace this morning, and I showed her all the different dimensions for any number of how you came to that particular number. There's a story behind it.
Right.
And I said last night, I was actually in tears in the middle of the night because the numbers are now alive.
Wow.
They're alive.
There's
They're literally
a story
alive.
behind each number. It's not just digits.
Right.
Wow.
Exactly. And we're going to have a lot of fun with it.
That sounds great.
But because I came up with the solution last night on Twitter, it's out there. You can look up zero does not exist, #0 does not exist. You can look up ZE0, whatever, Z or does not exist, whatever the acronym is. And so, I'm a smart guy. I read a lot. Is it going to get us anywhere? That's the question. So when it comes to medical practice, when it comes to how we educate our children, when it comes to how we treat each other in society, you can have really super smart people, but that's fine. But how do we use what's under the hood to transform society to a better place?
Well, because if you're stuck at a mental level and it never gets to the level of the heart, then it becomes just an intellectual exercise.
Yeah.
If the mind is the servant of the heart and brings logic and reason in service of the heart, then it's massively improving humanity, because we're bringing the intellect down into, not down, but permeated with the realm of feeling and spirit and emotion and connection, which is what's needed.
So when like Stanley Plotkin or Paul Offit or let's say Peter Hotez is standing on the steps of a Capitol building, like I've been, shouting to the crowd, "What do you want?" And they shout back, "Science." And I say, "When do you want it?" They shout, "Now."
Yes.
Or chanting into a megaphone, I'm relating through my heart, mind, body, soul. I'm bringing everything that I have to wake up every fiber of each individual person's abilities. I want to speak when I speak, I try to speak to their abilities.
Yes.
And so when I say, what can we do? We can get all the smartest people in the world, call it the NIH, and look what happens. Right?
Right. Well, I love
the allegedly most smart.
One of your one of your rally speeches, you started with America. Yeah. America. I mean, you didn't start with, here's the neurotoxicity of aluminum, right?
Right.
Here's the
micrograms of this.
Here's the micrograms of right here. Here's a chart that talks about how chronic immune activation results from aluminum, bioaccumulation. Right. You started with the heart.
That was on the actually on the lawn in Washington, D.C.
Okay. Yes.
So that was on the Capitol Mall.
That was awesome.
Thank you. I still want to know if I had the ability to bring like 80 of the smartest people together, and we all got around and we said, yes, look how smart we are, and we know that aluminum actually is accumulating and not clearing as fast as they think it is because it's not soluble in the plasma, and yet you're measuring plasma. Right. Other than pull out your hair and say you're not supposed to use that type of oil in that engine, right?
Yes.
And get upset about it.
Yeah.
How can we harness the smarts that we do have in society that are, for lack of a better word, woke to the toxins about what we're actually doing to our children?
Well, there's one thing to know, and then there's another thing to say.
Yeah.
Or to witness to what you know. And I have found, and I was testifying in Colorado about a vaccine bill, and here I am standing in the hall waiting to testify, and I'm with another person who was waiting to testify, the super smart Colorado mom, and we were just sharing stories. And she said, I was pregnant with my first child, and many of my friends were physicians, and I talked to them. I said, hey, just between you and me, she knew 15 physicians well and personally, and she said, if you have a kid, or if you haven't had a kid, you're going to have a kid, whatever it is, if it's your kid, past, present, or future, would you vaccinate them? And she said half of them said no, and the half that said no, 7 out of the 15, it's not quite half, said, but I can't say that, right? Because my career is over, right, if I say what I know, right? And so there's this. It's the knowing, which is the one thing, but then there's the courage to witness to and speak to what you know. And that's where I think we get this problem, because there's so much, professional assassination going on.
Yeah, which doesn't affect me at all.
Doesn't affect you at all.
They could. The only thing that they could get me with would be the trips to Epstein's Island that I never took, right? Some kind of abusive...
The list just came out.
Right, exactly. Well, I'm not on it, thank you. No, but my point is, with all due respect to the children that were hurt by whoever,
it's horrifying.
Right, it is horrifying. My point is that I don't have a history of skeletons. Nobody's perfect. Yeah. I'm not a saint. I'm not up for, ascension into heaven or anything. My point is, I don't have a lot of skeletons in my closet where I hurt people because I spent my professional life being the opposite of a person who hurt people.
Yes.
That was my choice in life to say that's not what I want to be. I'm gonna model myself into someone as a very young person, into someone who puts good into the world.
Right.
And I'm not walking on water here. I'm not looking for accolades, but I'm frustrated because, listen, I'm going to explain something just for the people that are listening. when they pass vaccine mandates, and they say, and the argument for taking away exemptions, and this is one of the big hot ticket items prior to COVID, they always say you need coverage of 95%. They say CDC, they arm wave.
Complete BS.
Right, it's BS. And you're having the emotional reaction of that's not logical, right?
No, it's not
so
true.
You're connected to that. So the motivation then becomes what is the truth.
Right.
And an alternative way of looking at this is that, well, it's not 95% coverage for all pathogens. Let's say we're not against vaccination, or let's put mandates aside, put exemptions aside. Why are we shooting for 95% when for something that has a small R naught, the coverage necessary to get herd immunity, assuming that it exists, just for the sake of the argument, which is not undone by saying, but it's not true. For the sake of the argument means, stay with me on this. An R naught, something like coronavirus, we need 50% coverage, maybe. Not 95% coverage. So why is anybody contemplating a universal mandate for coronavirus right out of the gate? And this is where we then take it and invert it into applying it to each and every pathogen on the schedule. All you need to do is take R naught from each and every pathogen on the schedule.
You should explain that term to your listeners.
So thank you. So R naught is the basic reproduction number. It's not a rate. It's the number of people you can be expected to infect. You can expect to infect if you're infected with the virus or bacterium or any other contagious agent in a particular setting. And the minute you say it's a rate, you've confused everybody. So what R naught is the number. It's an approximation of it's a measure that we use to understand how fast the virus is going to spread through the population. But there's actually an equation. It's 1 minus 1 over R naught that tells you the coverage that you need in a population to affect herd immunity from a vaccine. So why are we talking 95%? For all vaccines on the CDC schedule. And that's what I wanted to put it out there, because I have a table, I have a spreadsheet, everybody's welcome to have it, where they can take that spreadsheet and they can take it to their representatives, or they can take it to the committee that's considering stripping exemptions and say, why are we not contemplating what the effective coverage should be for each pathogen separately when we look at the coverage in the school? And it turns out when you do that math, almost all the kids in Massachusetts, almost all of them they have so much over-vaccination.
For sure.
For herd immunity.
Okay. So we right. Was that? Finished? So there's so many layers to this herd immunity thing, because that's the justification for the mandates, and this goes back to Dr. Floyd Herdrick in 1931, who coined the term or came up with herd immunity based on looking at measles in Baltimore, looking at measles in Chicago. And he found that, I think it was Baltimore, 58% in a particular community got natural wild measles. This is
before they knocked it out with the vaccine.
This is 3.5 decades before the vaccine was even available. So there was no, measles vaccine was 1963. He was looking at data from 1927 to 1930. Published his findings, I believe, in around 1931. And in one town, I think it was Baltimore, was 58%. In the other town, I think it was Chicago, was like 63%. And he said if they're naturally exposed, then that reduces the infection rate in that community dramatically. And so that's where herd immunity came from. And they assumed that if you gave a vaccine, it would produce the same lifelong, quote, immunity to that pathogen. Several problems with that supposition was that in immunology, there's this false idea that antibodies equals immunity. No antibodies equals susceptibility.
And our understanding of immunity before the vaccine also had booster immunization from asymptomatic infection.
Absolutely. Absolutely. Well, sure, because look at measles. You had, before 1963, when the vaccine was introduced, you had, mothers passing on, maternal antibodies. You had, you had natural exposure in the community. It was still a thing in the 60s. Basically, every kid in the United States got the measles in the late 50s and early 60s before the vaccine was available, and the death rate and this is the thing we should be concerned about, the death rate went down 99.48% from the peak of the mortality, which was 1915 to 1962, the year before the vaccine was available. Mortality rate went down 99.48%.
Sanitation.
Of course,
right.
Sanitation, hygiene, living and working conditions, nutrition, all these other factors.
Yeah.
So they made this leap to say, well, a natural infection produces lifelong, quote, protection, therefore a vaccine will, ignoring that there's primary vaccine failure. 5 to 10% of folks don't respond to a vaccine. They won't generate an antibody response. And ignoring the fact of secondary vaccine failure, that most vaccines only have effects for 2 to 3 years, at most 10.
That's why you have to have boosters.
Well, that led to the boosters. Right. Yeah, the whole booster thing. But this whole 95% is completely arbitrary. If you look at a medical textbook from 20 years ago, it was 60 to 70%,
right,
or 70 to 80%,
right.
So to make that leap from natural infection, where there is herd immunity, that's how we get through every flu season. Is every year we develop herd immunity. Most people, like COVID, most people who get exposed to the flu that's floating around that year never become symptomatic. Right. Their body recognizes it, deals with it, generates response.
It's cross protection from the previous strains.
And that too.
Right.
And that too. And yeah, you've gone through the virology on this and type replacement and all that in like extreme detail. But
well, go back to the measles for a minute. I don't want to jump on your point, but back in the late 1950s, the people developing the current MMR, the measles vaccination strategy, they were told that if you don't replace the measles type in the vaccine with the wild type, like we do with the flu, that your vaccine is going to be defunct by 2022.
Really?
Yes.
Oh, I didn't know that.
We're starting to see outbreaks where the measles vaccine just is no longer working as well. It only protects against symptoms. You still have a passable infection, this kind of thing. And it's very controversial because they want to blame anti-vaxxers.
Yeah.
Which
is ridiculous.
But if you look at the biology of the virus and you look at the fact that it's an antiquated product, it's outdated. See the serial passage in the lab to bring up the vaccine type? I think they updated it once or something.
Right.
But that was because the new strain came into being. Now they have this more lethal type strain that is a D type.
Well, right. Well, there was atypical measles that came, I think it was due to viral mutation from the vaccine strain, because the vaccine strain is not the wild strain. So that's like a whole thing. But there's never been herd immunity from vaccines.
Something like 38% of cases in Disneyland were actually measles infections diagnosed as measles.
Yes.
That was shown by PCR.
And it was also that some of those Disneyland folks it was the vaccine strain that they were infected with, not the wild.
Exactly, that's what I just said, right?
Yeah. But you're just talking about the kids. Like the majority of the U.S. population, about 327 million people, have had no vaccine effects for several decades.
Right.
And there have been no resurgent epidemics because of vaccines.
But now we have the young kids that were only vaccinated. They only were exposed to the vaccine type because of the effective eradication of the wild type, except for the suppression. And now they're sitting ducks as adults. And so my understanding is that the people at the extreme, the very young who can't get the passive protection from maternal passive from breast milk, and then the very elderly are the ones that are going to be at highest risk. So they're going to try to vaccinate everybody.
Well, the adult mandates are definitely in the offing for sure. But this whole model of you can vaccinate your way to health, and if you don't have antibodies, you're vulnerable. Just ignores the rest of the immune system. But immunologists are trained that antibodies equals immunity. If you don't have antibodies, you're susceptible. Ignoring cellular or innate immunity, ignoring the microbiome, ignoring neurological immunity in the glial cells.
And of course, ignoring any adverse event from the vaccines.
Of course, ignoring the interferon system, ignoring the endocannabinoid system, ignoring the rest of our immunity, which, so the whole, vaccine science is based on this 75-year-old science of this, it's just innate and acquired and all that matters are antibodies, is really flawed. And then we come to COVID, and, at the end of the day, we have a mortality rate less now than the seasonal flu. all of this government, quarantine, mass.
Do you mean infected case fatality rate?
Right, exactly.
Right.
Total exposure. Yeah. If you look at the number of folks who are exposed, and you could probably speak to the numbers on this better than I could, but the CFR, the case fatality rate, is very low.
Yeah.
The estimates are like around 0.04 to maybe 0.1%, perhaps, which is an annual flu, maybe a severe seasonal flu.
Flu is as bad as 0.1.
Yeah,
that's a bad year, right?
That's a bad year.
And then COVID is something like 0.26.
Okay.
Right.
Okay. Yeah, I've heard different. There's different numbers.
But they're not comparable, right? And this puts us in a conundrum, and this is where I'm going to go off on a rant because CDC stopped accurately tracking influenza deaths back in 2015. 2014, they separated influenza, RSV, SV, and COVID deaths. They separated them out. And pneumonia.
They
separated.
were lumping pneumonia and flu together.
2015, they started lumping in influenza and pneumonia and COVID, and not COVID-19, but COVID, synaptical virus, and what was the other one? No matter how you got pneumonia, they call it flu disease.
Oh. Yeah.
And so when we think 55,000 deaths a year, whatever they say, 80,000 deaths a year, they're actually talking about viral pneumonia of unknown origin, of unknown type, and they call it flu. And everybody thinks influenza, and the government, your government, our government, the agency, FDA, CDC, they use flu disease, flu syndrome interchangeably with influenza on the materials they distribute and when they're talking to the public. In reality, if you go back, I think it's about 9% or something like that of the cases are likely due to influenza virus. Which means if you have a year of 55,000, you're talking about maybe, 5,000 deaths from influenza a year.
Right. Because isn't it true that most flu-like illness is not viral in origin?
Right. You get pneumonia from many, many other things. And this goes all the way back to the Spanish flu, where the doctors started debating whether it was bacteria. Did they die from bacteria or did they die from the virus? Who cares? They died. Right. The point is the virus set up the conditions by which a bacterial infection was more likely, and so died from. We're still doing it today. We've been doing this since the turn of the last century.
Yes. Well, that's a huge point, Jack, because folks are being diagnosed as a COVID death, whether they die from COVID, which happens, but less often than dying with COVID, right? So, and they're folks are being diagnosed as a COVID death subjectively based on clinical symptoms. They had a fever and a cough. That could be anything, right? Or they die of a heart attack, but it's listed as a COVID death. They died of a motorcycle
accident.
Motorcycle accident listed as a COVID death. So
they test positive for the virus, but I had Dr. Lee here on Breaking Science, Dr. Sinhan Lee.
Oh, sure.
And he said that CDC's tests are wrong like 1 out of 4 times.
They absolutely are.
With false positives and false negatives.
Absolutely.
And worse than that, Michael, he said that the reference sets, the reference materials that they send out to validate new tests, they're mislabeled because they're CDC positive. Or CDC negative. According to CDC's PCR test, which is flawed. Right. So where do we really stand on that motorcycle person? Or how many people said, listen, I'm testing positive, I don't have any symptoms. Right. And then on top of it, we have the do-gooders who are inflating numbers to make it look worse in their state.
There's a lot of that.
Right?
There's a lot of that. So my conclusion, Jack, is that none of the case numbers are real.
Right.
None of the mortality numbers are real.
Right.
For several reasons. One is we don't yet have validated testing.
Right.
RT-PCR, according to Carrie Mullins, who developed the test, was never designed for clinical diagnosis. Should never be used for clinical diagnosis.
Right, and that's true for any screening technology. Imagine if you screened everybody with a CT scan every year.
Oh.
How many false positives would you get?
Okay.
The damn test is too sensitive. You're going to pick up the virus that happens to be in your nasopharyngeal tract. That I've been harping on the difference between a virus being present that you've sampled, an infection.
Yeah, is that why you're sick?
An active infection.
Yes, is that why you're sick?
And COVID-19. There's differences. Those are different things. So if you screen everybody, you find if you're test positive, you don't have COVID. They need to change that. But here's what I want to say.
Yeah.
Our government right now has a choice, and I'm not talking Trump versus Fauci and all that. Our government has a choice. They have to choose either the CDC is corrupt FDA's corrupt, or they're completely inept. Because if you buy the numbers,
yes.
we have the worst healthcare system in the world.
Yes.
Right? We have the worst public health system in the world. Or they're corrupt. So which of the two evils do you think they're going to settle for?
Right.
Those are the two choices. What are they going to settle for?
Right. No, that's a good point.
Because I don't want to live in the United States if, they can't get COVID under control because they didn't get the testing right.
No.
Right?
As of today, they still don't have the testing.
Right. Redfield said the other day to Sanjay Gupta, we need a viable testing procedure in the United States. January 16th. Wow. January 16th, they had access to the accurate test, an accurate test from Germany. 41 other countries did that test. They did early contact tracing, and not a single person has been fired or resigned from the CDC.
Oh, wow.
CDC made the call, no, we're not going to take that test from Germany. They actually wanted to create their own test. They did. They screwed it up. They sent out a flawed test. They let the people off a Princess cruise ship.
Right.
They were going to drop them off at a mall. That's how competent these people are. Yes, you passed our test, so we're going to put you in a mall. This was in not San Diego, but Santa Cruz or something. And the mayor said no, and they put him on in a military facility. Nevertheless, then they intermingled and went out, and then they got diagnosed with COVID.
Sure.
And so, with CDC's producing a failed, flawed test that was, and they were the only game in town from February till March.
That's right.
Then the FDA allowed emergency use authorization for everybody else. And what does Fauci have to say about it? Fauci says it's nobody's fault. There's no bad actors. Let's not look into it right now. Yeah, let's look into it right now. How about that? Let's look into it right now where CDC messed up their failed and flawed test. They spread COVID all around the country.
PCR testing at that time.
Right. They spread COVID all around the country, making it much worse than it is, and now they can't even count. So they can't make a test. Now, remember back with SARS in 2003? The CDC website says, through accurate contact tracing and through accurate testing, we shut down the SARS outbreak in Canada. Our CDC is taking that. So if they can do an accurate PCR test in 2006, or whatever, whenever they shut it down, 2003, 2004, what happened between then and 2020?
Right.
Did they forget how to make a PCR test?
Okay, so Tom Cowan in San Francisco is a physician. He was talking about PCR testing. He was talking about SARG in a conversation he had, and he said if you run the PCR test for 20 cycles, or amplify the thing 20 times, nobody tests positive.
Right. If
you amplify or run 60 cycles, everybody tests positive. So it's completely arbitrary. I mean, what's your take on that?
That's a technical point. I know that it's in the real world when you do a PCR reaction and you do a PCR experiment, you have a positive control,
right,
which you know has the sample, it has the material.
Right.
You have a negative control, and you can run 100 cycles and you won't get amplification if the product's not present in the okay. So that means that the kit must be contaminated. Or the laboratory running it is contaminated. And I wouldn't put it past those things being true. But there might also be off-target amplification of the human genome to the point where you're getting something.
Right.
And so when I first saw the primer list from CDC, I wrote to the FDA and I said, there's a problem here. You have non-specific targeting going on with these primers to human sequences. And you're going to have a problem. They wrote back and said, thank you, we'll share it with the team. And then, and then we have Singhan Lee, who came on, who just published a paper, which I was a peer reviewer on. They did open peer review on it. And he said that they're not using the gold standard validation. The way to solve the problem Sarah G brought up is to sequence your product and see what you have.
Right.
Is it COVID-19 or is it human?
Right.
And once you do that, then you'll know whether the person has a diagnosis or not. Nobody's doing the gold standard validation.
Right. And on top of that, from a clinical perspective, you don't know that virus is causing the person's disease.
Right. That's a whole other thing. That's right. You can have like I said, if you test kids' noses, all healthy, you're going to find viruses.
Of course.
Right? Why? Because they're immune to them.
Right.
A person carrying a virus is not necessarily going to transmit either, because if your immune system works, it keeps the viremia down.
Right.
So if there's anything you can do to increase the health of your immune system, to keep viremia down, you're doing a favor to everybody who's susceptible to getting COVID, influenza, or anything else like that.
Nobody's talking about immune support.
And you should do it for your country.
Absolutely.
You should do this as a patriotic duty. And we're going to be talking about this. There's a couple of programs we're kicking around here to make sure that you get fit, make sure that you have a good immune system for your country to protect your neighbor. That's right.
As a public service. Yeah,
that's right. Dell did a great job on Alex Jones. He was like, okay, listen, if you're going to tell me that I have to take this vaccine so that you don't get COVID from me, when I see you coming out of the grocery store and you've got your Doritos and you've got your Pepsi and everything, I'm going to be at the door and I'm going to say, you get back into that grocery store right now. You get. He said that he said some things. So anyway, the point is, it's a valid point.
Yeah.
So that brings us to hydroxychloroquine.
It does. Well, before we get on that, because the antibody tests.
Yeah.
And just to say a little bit about that, my understanding is those are mostly IgG. Right?
You can get IgM, IgG. IgM being you have a
more acute, IgG more historical.
Current, right.
IgG
current.
more historical.
Right.
But they're diagnosing cases according to IgG testing.
Right.
Come on.
You're showing immunity.
You're immune. You're not a case.
That's right.
You're asymptomatic and you're immune, and you're being counted as a case.
We're just too damn smart here.
Come on.
We are just way ahead of the CDC. We know what you're up to.
Yeah, and in every state, they even call proof of immunity, in terms of vaccines. Yeah. You have proof of immunity as a positive IgG test to that antibody for that pathogen.
It's like titers,
Come on. Right. You can't say it's proof of immunity for vaccinated disease and call it a case.
That's right.
It's a COVID case with the same testing.
Yeah, that's an excellent point, Michael. So if you can show that you have IgG status against measles, it doesn't matter if you had the infection or the vaccine. They're going to say you don't have to vaccinate. That's Hawley's law from the family there in the Stavola family, whose daughter Holly died after MMR, and I think it was MMR. And they said if we can test positive for the IgG, you don't have to get the vaccine.
Right.
It doesn't matter whether you got it from an infection or injection.
Right.
So if there is any way that you can bring your viremia down on your path to immunity, you're doing your neighbor a favor because you're less likely to pass it on. People with high viremia will pass it on.
Absolutely.
So let's talk about hydroxychloroquine, because that's the top.
Talk about one,
you can go ahead.
I have one more question because I want to talk about it.
Okay.
The vaccines, there's 80 different vaccines in development. The Moderna.
Just for COVID.
For COVID.
Right.
Now, you've talked about, this is a question because I don't know. I'm sure you'll know more about this. Are all of these vaccines, these are RNA vaccines?
Not all of them.
Not all of them. And are they all spike protein vaccines?
Some are experimenting with combination proteins. So there's an NLP protein plus a spike protein, but I think they all. I'm pretty sure they all have the spike protein in them.
Now you showed you pointed out the research from SARS-1 in 2003 where they experimented with a spike protein vaccine to the 2003 SARS and bad stuff happened.
Right. That's the pathogenic priming. Correct.
Right. So are we on that path? If they're using spike protein vaccines for COVID-2 or COVID-19, that we're going to run into the same problem.
It's difficult to know because they didn't do the animal studies. They skipped over the animal studies.
How could you do that? How could you skip animal studies?
Well, because you find pathogenic priming and then you shoot yourself in the foot. It's really clear that they didn't want to find it. They didn't want dead animals, right? Okay. They'd rather have dead people and say, well, it's worth the risk. Because we had to shut down society.
Wow.
I think that's their thinking. It's like it doesn't matter if there's pathogenic priming. This thing is out of control. They're still focused on the case fatality rate based on symptom-based case fatality rates.
Right.
That motivation, the entire motivation for all of the vaccine and everything comes from way back at the beginning when it was 20% case, you're going to die if you have diabetes. You have a 20% case fatality rate if you have diabetes and COVID. That's not true anymore.
Right.
It's not true for a lot of reasons. It's not true because now we know the true infection rate. The Chinese put it out that 85% of the cases that they had in the country, they didn't find them. They estimate.
Wow.
85% of people that had the infection they got away scot-free. They didn't know they even had anything.
Right. Well, that's the majority of cases. The majority of folks exposed to COVID are asymptomatic.
Right.
They recover and never knew they had it.
Right. So now we've got this, we're worried about the elderly. Well, now we know that like the majority of the deaths that occur, I forget what the percentages are, occur in nursing homes.
Yes.
These are people that are, the families, they're so sick, they need attending care every moment of the day.
Yes.
And they're in a very closed environment.
Of course.
And they're not given, they're given a vaccine for sure.
Right. And that's how
they're given a vaccine for sure.
Yes.
Right?
Yes.
Because if you're unconscious in the United States, there's a standing order to vaccinate you against the flu. So how many times in a nursing home is a person unconscious and somebody walks by and, did you get your flu? Okay, so I assume every person in a nursing home gets the influenza vaccine.
Yes.
And then there's
which increases mortality from COVID.
That's what the veteran study showed.
Yes.
Right.
36%.
Exactly. 36% increase of getting COVID.
Right.
Not 30% increase of mortality.
Right.
But the entire impetus of doing all of the vaccine and everything is based on the initial fear that we had when we thought that this thing was a serious illness.
Totally.
And that it was
but now we know
10 times worse than the flu.
It's not.
20 times worse than the flu.
It's not.
And it's like, if I had to estimate, if they put me on a stand and I had to testify, based on CDC's number, after I said the CDC cooked the books on influenza and say, I can't answer the question.
Which they did. Yeah.
Which they did. So I can't really answer your question.
Yeah.
But it looks like it's maybe a double flu. Maybe a double flu.
Yeah, and so all of this mass quarantine lockdown stuff is unjustified for something that's a severe annual flu.
Social distancing, the elbow bump, protect the elderly.
But
that's
all
all stuff.
Impeding herd immunity.
Right, that's true. But okay, let me ask you this. This is a tough question.
Okay.
How bad would a virus have to be relative to flu before you said yes, we should slow it down, so that everybody can be cautious about protecting grandma?
It's a good question.
How is it? 3 times, 4 times, 5 times?
Question. Well, it's modified partly because if you have effective treatments, which is the next question. If you have effective treatments, we're not really concerned.
Right.
If people get sick.
Right.
If we have effective treatment, so my 3-point plan that I've been talking about, in my weekly webinars on this since March, is immune enhancement.
Right.
So take care of yourself, eat
real immune enhancement,
natural immune enhancement. So
not disease enhancement.
No disease. So sun exposure, exercise, whole foods diet, loving relationships, social contact.
Yeah.
Not social distancing. So supplements, herbs. Things for prevention. Stay well. That's the best thing imaginable. Then step 2, point 2 is effective treatments, and there's lots of natural treatments that work, and then we have pharmaceutical treatments that work if somebody gets sick. And then the third part is broad exposure.
Yeah.
Broad exposure, and that way we get to the naturals, the only real immunity there is.
What if I disagreed with you on broad exposure only to say that not to protect the healthcare industry because they wanted 2 weeks and they got apparently eternity.
Exactly.
We're going to protect the healthcare industry from helping us for an eternity.
Right.
So it's not going to be 2 weeks. But what if I said I agree with you, except for if we don't, we can control the rate of the flow through the population, then we can better protect those that truly are at risk.
Well,
of death. Buddy.
Well, because mortality should be the measure, and we don't have any good mortality statistics. Because people are being diagnosed as a COVID death.
But we can argue hypothetical.
Yeah, well, that's true. Okay.
So let's take a hypothetical scenario.
Yeah.
And I'm going to go back to the original question.
Yeah.
Whatever flu is, it's 55,000 or it's 5,000, somewhere between, right? Order of magnitude difference.
Right.
Pick your number, and then go. Okay, if it's 50,000 or 5,000, how much worse does a virus have to be before we do just mild social distancing to slow it down, so that we know that wait a minute. You might next go visit your grandma, or 2 days you might visit your grandma, and I don't want to necessarily infect you. That we have it's like, you've got a race car. How many people take their Lamborghini on the street and do 200 miles on the street? Right? You have control over the rate at which you let it flow. So let's say I agree with you in principle that we want to reach natural immunity through infection eventually.
Yeah.
But what if there's a middle ground that we can say, all right, if it's 3 times worse of flu, 4 times, 5 times, 6 times, I think we need to have that conversation.
Yeah.
And then ask, is coronavirus 19 really that? Without cooking books. What does it look like in other countries? What does the mortality rate look like in other countries where we know that they're not cooking the books?
Yeah. Well, it's a great question. I haven't thought about that, honestly. I think it's an important question to ask. And it's modified by, the question, who are we separating out? Are we separating out the folks who are sick and symptomatic and high risk? Or are we separating everybody from everybody?
I don't mean a universal thing. I mean like a general awareness, a general awareness thing.
Right.
No, I don't even mean saying all people over 65 or all people with diabetes.
Right.
That's too draconian for me.
Right.
The state shouldn't be involved, is what I'm saying. I've been harping on independent, private in-home testing from the beginning.
Yes, you have.
So whatever the complexities of testing are, if a person wants to know what their IgG, IgM status, and they want to use that information from the beginning, that's their business.
Yes.
Right? Just like with a vaccine in New Jersey.
It is.
If I want to know my IgG status, I might find it, I might report it, I might not. Right? So my point is a more subtle one. I don't think that a heavy-handed top-down public health infrastructure is healthy for us.
No.
I think it's extremely unhealthy for this kind of control. And people have also misinterpreted me because I was one of the first people to say doing a full fist bump because we don't know how bad this is.
Right.
And I was the first one to say that you might not want to share utensils and all the rest. To slow it down so we can figure out what the heck we're dealing with.
Exactly. Well, that was prudent at the time.
Okay, right.
We didn't.
So now we know where we stand.
Yes.
We've got fake data.
A lot of it.
A lot of fake numbers.
A lot of it.
100% false positive testing coming out of Florida.
Yes.
The FDA is going to investigate. I think the FBI should investigate.
Yeah.
But let's take this out of today.
Okay.
Let's generalize.
Okay.
And say, what would a rational policy look like if we decided that the magic number was a flu? You got a new virus that looks like it's respiratory, and it's got 6 times the death rate. That's the magic number we've all decided is.
Sure. Okay.
Before we do general recommendations on hand washing, keeping your maybe social distancing, certainly not shaking hands and sanitizing common surfaces, so that we can not so we can figure out, so that we can protect those that we know that are at most risk.
Yes.
Right. That to me would be a more reasonable.
That's more reasonable, and that's not what's been happening.
No, not at all.
And so that this whole
it's like telling a kid you don't want to share a comb at school because you might get lice. There's no lice, right? There's nothing wrong with the comb. There's nothing wrong with the kid.
Exactly.
It's just generally good advice.
Exactly.
And we don't have to become a nation of gerbophobes.
No.
We don't have to yell at each other for not wearing a mask.
No. But that's the problem, Jack. I mean, you're nailing it on the head. That the government has been so far over the top in taking personal sovereignty away from, just let people figure out, trust people to do the right thing.
So you and I both believe that people are rational.
Well, yeah.
To the extent that they will look after their own interest.
I do. And people are not looking out to hurt other people. Because basically you have 2 approaches to government. One says individuals have the know best how to best take care of themselves and their families.
Yes.
And option 2, which is the extreme left these days, is the government knows better than you do how you should live your life. When it comes to masking, social distancing, vaccines, everything, the government knows best and will tell you how to live your life.
Okay,
and
so
that's a problem.
So the middle, it literally tell you like that by law, you're breaking the law if you don't mask and you go into a store or whatever.
Well,
but there's a middle ground.
Yeah.
The middle ground is people knowing that people are rational actors for the most part.
Yes.
There's the original,
there's always
occasional crazy outliers. Thank you. Such as these are mean people. He's a gentleman. There's going to be crazies in the population that are going to put other people in themselves in harm's way. They're not rational actors.
Yeah.
But even the most uneducated people feed their children.
Yeah.
Even for the most part.
For sure, they
do.
do.
If they're given the resources to, if they have the resources to do so, they care enough about their children themselves to eat. Okay, so the point is, most people in the United States will act rationally if they're given accurate and real information.
Absolutely.
So the government's role should be accurate and real and reliable information, and they need to be held accountable when they give bad information.
Absolutely.
So Fauci's all over the map.
So, he contradicts himself every week.
And my statement is, HHS, you're all over the road. Go home. You're drunk.
Absolutely.
I'll drive you home, HHS.
Absolutely.
Just go away.
Absolutely.
Right. So Fauci's a problem. Redfield's a problem. FDA's a problem, and so on. These regulatory agencies are giving unreliable, inconsistent, changing information, admitting that they're lying to the public.
Yes.
And where does that leave the United States of America? Public. It leaves us. I'm jealous of those other countries.
For sure.
I'm looking over. I'm looking over the other countries that don't have the mortality rate that we wink have. Right. The case rate that we wink have.
Right.
I saw Fauci winking during his testimony. By the way, somebody threw him a lifesaver. But anyway.
Yeah.
When we get to hydroxychloroquine, let's talk about hydroxychloroquine. Okay. Reducing viremia is if you want to feel good about what you're doing, you need to keep your immune system well, right?
Yes, absolutely.
Because you not only help yourself, you help your neighbor, because you're reducing your body viremia to the point where you're less likely to transmit.
Absolutely.
Right?
And so the stronger the immune system, the less pathogenic burden you have. Okay. That's just the basic idea. It's the supply and demand.
Right.
What is your supply of immune resistance?
Right.
As compared to the demand of your pathogenic exposure.
And how long you're sick. So if you're sick for 9 days, you're going to be spreading the virus as opposed to if you're sick for 3 days.
Yes.
Right?
Yes.
So we have an obligation, don't we, to keep our viremia down as we develop our immunity.
Well, right. And see, that's a great point, Jack, because when you look after your immune system with diet, exercise, sunlight exposure, all that good things, supplements, that increases your resistance to not just COVID-19, but everything. Yeah. All 4 classes of pathogens, bacterial, viral, fungal, and parasitic, you increase your resistance to everything.
Yeah.
Not just a single thing. And if you do get exposed to something that maybe your body hasn't seen before, you may get sniffles for a few days, but you're not going to get really ill. And so that's why we're seeing almost the vast majority of the mortality of people dying. We don't know if it's from or with COVID-19.
Depends on the case, right?
These were folks who were sick.
Yeah.
You're more likely to get complications from everything.
They tend to be Th2 skewed in their immune systems. The people that die.
Okay.
They have something wrong with them. It's an inflammatory kind of cytokine storm-prone system.
Well, and
we know how to get there. We know how to skew your immune system Th2 wise.
Yes. Yeah, and you'll get the folks who get the cytokine storms generally have more prolonged severe infections.
Yes.
They have generally weakened general defenses, and so that an infection is more likely to be more severe and more prolonged.
Yeah, I've heard from so many doctors that we can predict exactly what course a person's going to have now based on all these variables that we can look at. We know how to treat it now. The case fatality rate is dropping. It's plummeting.
Absolutely.
They're not doing ventilators anymore.
No,
right?
Shouldn't.
They shouldn't.
It's a blood disease in part.
Right. And they're using blood thinners to stop the coagulopathy
from the endothelial dysfunction. Yeah, for sure.
Right.
Yeah, and that's really important because this whole approach to if you're following a reductionist path, you focus on the path.
Well, America wants a pill.
Yeah, give me a pill. But in general, the whole antibiotic vaccine approach is pathogen centered.
Right.
The holistic approach is terrain centered.
Correct.
As Béchamp said, or even Pasteur said on his deathbed, supposedly, the pathogen is nothing, the terrain is everything. To his best friend before he died in French. Who knows? But but the idea is, if you look after the terrain, the pathogen becomes less important.
Yes.
But this pathogen-centered reductionist approach leads to a lot of collateral damage.
Okay, let's start with hydroxychloroquine, just because America wants a pill.
Yeah.
So there's a lot of debate right now about hydroxychloroquine.
Sure.
Some doctors are for it, some are not. Doctors that are for it are being silenced.
Yeah.
There's a Baylor doctor. I just sent this out. If this is live here, let's see. Yes, a Baylor cardiologists support hydroxychloroquine emergency use authorizations. 2 Baylor cardiologists recently sent a letter to the FDA. I'm reading from the Texan News.
Yeah.
Supporting a request for emergency use authorization of hydroxychloroquine.
Yeah.
This is Dr. Kevin Whelan, Chief of Cardiology at Baylor Heart and Vascular Hospital in Dallas, and Dr. Peter McCullough, a clinical cardiologist and professor at the Texas A&M. This was 3 days ago.
Yeah.
They issued a letter telling the FDA that we really need to do this. And there's a cardiologist. These are cardiologists, so if you're saying that there's going to be these side effects of hydroxychloroquine that are apparently newly discovered because of COVID.
No, come on.
Right?
Yeah, drugs been for 75 years.
There are doctors that are for hydroxychloroquine. So let's say that's all you can do. Let's say remdesivir, something like that. There's a lot of other studies that could be useful. Well, we'll get to the zinc. I want to talk pharmaceuticals first because I have here a list of there's remdesivir. I'm sorry, people, I have to look it up. But well, let's say that there's a list of pharmaceuticals. If we go just pill-wise first and get that out of the way, that dexamethasone decreased mortality in hospitalized patients on oxygen or mechanical ventilation. This came to me from the West Virginia Health Freedom Group. Vitamin D deficiency. Treating vitamin D deficiency. So people with adequate vitamin D decreases the risk of a COVID-19 infection. And hydroxychloroquine is associated with 47% decrease in hospital mortality in Mount Sinai School, Medicine School. Okay. And hydroxychloroquine was associated with 66% reduction in hospital mortality at Henry Ford Hospital. That's the one that Fauci says is flawed. Now, get what Fauci says. Fauci says, well, that study's flawed, because we know that there are confounders in that study because many of those patients were also on corticosteroids. And we know that there's other studies that show that corticosteroids actually help with COVID-19. Why the hell is Fauci not banging the drum for corticosteroids? I'm sorry, yelling. Why the hell is he not banging the drum for corticosteroids if he knows that there's studies that show that corticosteroids help?
Because...
And he's caught, saying, with his pants down. Right?
Well,
And he's confusing the confounder, which they love to do in these studies, with a cofactor. Hydroxychloroquine plus the corticosteroids.
Synergistic.
He's misinterpreting science, and he's in charge of the NIAID. This is scary. That scares me to death.
Well, he's useless. Right? I mean, we know that he's an idiot. He's useless. He contradicts.
I don't think he's an idiot.
Well, maybe not an idiot.
I think he's smarter than. I think he's not as smart as he thinks he is, but he's not an idiot.
Or maybe it's a psyop where he's keeping all of us off balance by contradicting himself continually. I'll give you one more on mortality survival. Surviving acute infection is ionized calcium.
We'll get to those. That's not a pharmaceutical. Remember, stay with me on this. Also, previous studies of hydroxychloroquine were flawed. They used fraudulent databases, made-up data, excessively high doses, lethal doses, and late treatment. So these people were basically bound for right? And that study was retracted. And so why is our government not going, oh, wait a minute, there's something really wrong with that. Let's take a look at hydroxychloroquine, the balance of the studies, and say, let's go for it because it could reduce viremia and reduce transmission. So if it's true for hydroxychloroquine that it could reduce transmission, Dr. Michael Gaeta, what other ways are there that we can boost our immune system, keep our immune system healthy to the point where we're actually likely effectively reducing transmission of viruses?
Yeah, for sure. And maybe this will be our last topic for today. But I want to answer your question. The reason why Fauci is, I believe, suppressing valid treatments is because, just like Gates, it's all about lockdown until universal forced vaccination. I think that's the agenda. I think the agenda is string people along, create this so-called second wave, create this illusion of increasing mortality rates.
So let's back up, because there are going to be a lot of people that spark at that. How do they increase a second wave? How do they artificially create a second wave?
There's several reasons. One is more testing. So the more tests you do, the more positive cases you can get.
That's true in any country.
That's true.
Right.
That's true. Second reason is now people are coming back to hospitals for elective procedures, right? So folks who needed their knee replacement or their hernia repair or whatever, these are elective procedures, non-essential, are now coming back to the hospitals and have been for these procedures. They're automatically tested for COVID. When they come in on admission, they're tested for COVID.
There's also a delay in the testing results. There's that lag,
there's
and then there's reattribution of deaths to COVID,
which is happening constantly,
right.
For sure.
So ethical skeptic on Twitter is a very private person. He or she won't come out and identify who they are, but they're very, very
sure.
They have high numeracy.
Yeah.
They're very smart with numbers.
Yeah.
The smartest people out there with numbers that you've ever seen. That's a Trump impression for you people. But this person predicted that there would be a second bump that was based on holding back data from the initial one.
Okay, I didn't think of that.
And they're shifting them to current with a gazillion different numbers of excuses.
Well, that could be. And then you have the two physicians who predicted a second wave because of social distancing and suppression of exposure.
But we're not seeing a second wave in other countries that did social distancing. We're not seeing
that's true.
We're not seeing that.
That's why
something's missing.
I believe it is because we're cooking the books so bad.
Yeah.
In terms, a person gets tested for COVID 5 times, they test positive 5 times, it's counted as 5 cases.
Definitely.
So you have all this cooking the books to inflate the numbers, to scare people, string them along, new lockdown, we're locking down again, until the savior shows up, which is the Moderna or whoever.
Do you think allopathy is in so much trouble financially that they really need? They keep coming back to the well. They got billions of dollars for Zika.
Yeah.
They got that allopathy itself.
Yeah.
They tried to do this insurance thing. Trump took it away.
Yeah.
Are they starving to death and that they need to actually hold us hostage?
That I can't explain. I don't know. I don't know if
it's a runaway train, right? Because
I think so.
The insurance is messy too.
Yeah.
If the more money you handle, the more money you make as an insurer.
For sure.
That's messed up, and that's what our country's in right now.
For sure. Yeah, the system is massively broken.
Yeah.
So you could look at a profit motive for pharma. You could look at a control motive for state governments. And the state governors, most of them, have destroyed the country and destroyed the economy through their policies. You could look at Gates' motivation to depopulate the planet. You could look at different players have different motivations, but at the end of the day, we have public policy decisions not based in sound science or evidence or data.
That's fundamental.
They're just making stuff up.
Right, that's fundamental. But I do want people to get the goods from you. The goods are, I'm not taking hydroxychloroquine. There are people out there who say, I don't want that drug.
Yeah.
How do people boost their immune system to reduce viremia, to protect their neighbor from a virus that they might or might not have?
Okay, so we need to look at, if you're looking at a blood test, you can look at certainly your 25 hydroxy-D. We'd like that to see above 40 or 50. Also look at ionized calcium. Ionized calcium is directly, at least associated with increased ICU mortality, increased sepsis, poor recovery from sepsis, and we could talk about the immunophysiology of that. But ionized calcium is absolutely essential for immune response. It's one of the reasons vitamin D is so helpful, because it has to do, in part, has 300 functions, but in part has to do with calcium absorption. We have to ingest calcium, and vitamin D works synergistically with parathormone to open up the calcium channels in the gut. So when we eat something or take a supplement that has calcium in it, it actually gets into the blood. And then
so there's some supplements that are calcium supplements that just basically pass through.
For sure. Calcium carbonate would be very not helpful. Calcium lactate would be ideal.
Okay.
Calcium citrate is a very good second best. But calcium status is important. You need vitamin D, you need vitamin F, which are the healthy fats, the unsaturated fatty acids, to diffuse that calcium out of the blood and get it into the cells, which need that calcium to fight off infection. So you have calcium, you have D, you have F, which are the healthy fats. You need sun exposure, partly for D. You need regular exercise, a low sugar, a nutrient-dense, low sugar diet, a low inflammation diet, intermittent fasting, where you eat all of your
So when you're going for that cupcake, you got to think that might push me over the edge where I could get an infection that I could give my mom.
Yes, you eat well to protect yourself, but also others. Because the stronger you are, the less your viral load's going to be.
Exactly.
So this is like very, very important. I need to, improve my exercise, my relationships, hug my kids, all these things, all the things that improve. We need social connection, not social distance.
Yeah, they're doing the opposite. There's so much depression. There's so much loneliness.
Suicide rates.
There's more suicides than...
It's insane. So again, my I will stand on this, that the government has done far more damage than the virus.
Oh my gosh. Yes.
No question. No question.
Yeah.
And people have to take a stand, that they do not want the government telling them how they should run their lives. And unfortunately, the extreme left has taken over the Democratic Party from its traditional base of liberals who promote free speech and curtail excessive corporate influence.
Right, you're supposed to look after the downtrodden and curtail what you said, the excessive corporate influence, and now they've got their mouth on the teat of pharma.
For sure.
For the first time, the Democratic Party found they're like nouveau riche, and they're falling all over themselves. Right? The party politics and liberalism is dangerous. It's dangerous to have one unitary party ideology. And people think liberalism is like, wow, that's what it is. It's not. Liberalism is much more. It can morph over the landscape and change. It's progressive. It adapts. This is, you better promote vaccination or you don't get the funding, and I'm not going to back your campaign.
Right.
From the top down.
Well, that's what's happened to the Democratic Party.
That's exactly right.
Is that the left has taken over the far left, the extreme left,
that's exactly right.
The violent revolution, government control, socialist, communist side, that has taken over the Democratic Party. And those are the folks who are saying government controls your life. And those are not liberals. Saying like
not at all. Those are not. No,
not at all.
See, I grew up in New York State.
Liberals are not leftists.
No, they're not. I grew up in New York State. I call myself a Mario Cuomo Democrat.
Oh, sure.
I mean,
nothing like his son.
Nothing like his son.
Anyway,
no way.
But we got to wrap today. But I've got to get.
So let's talk about two last things quickly. Quercetin.
Yeah.
Good.
Quercetin. One of the bioflavonoids. Rutin is the best anticoagulant in the world.
Rutin.
Yeah, if you look at the Harvard research out of 2000.
How do you spell that?
Rutin.
Okay.
It's part of the bioflavonoids, which includes quercetin, hesperidin, rutin. And the Harvard researchers, led by Dr. Flamenhaft at Harvard Medical School, found that rutin, Rutin, the most potent antithrombotic agent in the world.
So if you're getting really, really sick with COVID-19, you want to look at that.
And just heart attack prevention.
And talk to your doctor. And talk to your doctor.
A little disclaimer. But rutin from foods like buckwheat, from citrus, from olives. From
selenium?
Selenium, very important for thyroid function, immune function, but zinc is, we could talk about zinc for a long time.
Well, that's the protocol. Hydroxychloroquine, zinc, and Z-Pack.
Z-Pack, yeah.
So
so then you're taking it with the Z-Pack, taking care of possible bacterial co-infection or superinfection. The hydroxychloroquine addressing the hemoglobin damage, which is characteristic of COVID-19, and then the zinc is massive immune support, also cytoprotective through the NRF2 pathway. It's the only non-plant support of the nuclear erythroid factor to nuclear transcription factor master switch of cell defenses. Zinc.
So you teach courses on all this?
Absolutely. MichaelGaeta.com.
MichaelGaeta.com, people. Do you have to be a health professional to take your courses?
No, not at all. I've got Herbal Summer School coming up in a couple of weeks. A lot of the public are just want to use plant medicines to help themselves. And I do a free weekly webinar. We've done 18 of them so far. You covered me 1 week, and you did it 1 week, which was incredible. We got amazing feedback. But Michael Gaeta, GAETA.com.
I've got it up on the screen right now.
/immune, or just look from the homepage.
Right.
And I do a free weekly webinar called Natural Immune Support for Today's World. And just go to michaelgaeta.com or go direct to that page /immune, and you can sign up for free. That's free.
Michael, I'm getting to the point where I'm getting a bit of a crazy social media following.
Yes.
So I would encourage you, if you don't mind,
please
post or to have someone post when you go on your webinar.
Yeah.
post it on my social media, and then
love to.
I'll get it out. I'll help get it out there for
That'd
you.
be great.
I believe in you, man.
Yes, I believe in you too. You are one of my favorite people.
We're going to do the Love Fest in a minute. I believe in you because you speak a version of reality that I know is backed not just by experience, but it's backed by concern over human welfare.
Absolutely.
You're a very loving man.
We're here for each other.
And yeah, we totally are. And it's really been an honor. Thanks for popping in on your way across the country.
I'm so amped this worked out. I mean, we've talked together so many times, but always virtually. So it's great to be in the studio.
Yeah, we need to have you back on and get under the hood a little bit more.
Oh, love to. Yeah.
So, michaelgaeta.com, and you can register. Do you have a set fee for health professionals and another for the public, or how does that go?
Oh, for the immune?
Yeah.
It's free. Free for everybody.
Awesome.
Just free.
Awesome. All right, well, with that, I'm going to leave the website up. You heard it here, ladies and gentlemen, WWDNYK Studios, Dr. James Lyons.